welcome to the afternoon session of our day program, Digital Health Landscape in Europe. Sorry for the small delay. We ended up with a long delay in the morning, so break had to be a little bit shorter. So we are now continuing and starting, if you join us for the first time, with the session Health Apps, Improving Patients' Quality of Life while Maintaining Privacy. Just for your information, the initial idea, the focus on the privacy has been a little bit reduced. So we have now a broader spectrum on mobile healthcare and also on patients' data communicated via mobile platforms. We will see the four speakers will be Birgit Morillon of the European Commission. I will introduce you later on again. Malte von Tottleben from Empirica. He will speak on the WHO program Be Healthy, Be Mobile. Then we have Dr. Micaela Monteiro from SPMS in Portugal. And Professor Marx from Medical Hospital of Aachen and also president of the German Society of Telemedicine. So we are we will do let's say a tour de horizon and start this with the European Commission. So it's a pleasure to welcome Birgit Morillon. She is working with DG Connect at the unit H3, which is about well-being, and now located in Luxembourg with the move of the unit. So Birgit, your presentation is now loaded and you can start. Thank you for joining us.
Good afternoon. Thank you very much for the invitation and for having us here at this very important big fair on everything medical. I want to talk to you today about the digital transformation of health and care and how it will empower citizens and build a healthier society. So, digital technologies are a new window on our daily life when we have plenty of new tools and new technologies that create new opportunities to monitor our health, to keep healthy and to keep active. And we see it around here. There is a wearables booth. There are plenty of innovative tools and flexible devices that we can stick to our body, where we can monitor ourselves. We can quantify our body and measure whatever vital parameter that we want. And in the end, we hope that by doing so, we will become an empowered and healthy citizen. And capturing all these data, what do we do with all this data? But you don't have to worry, because for every wearable that you put on your body, we have an app that collects all the data, that stores the data, and if you're lucky, that aggregates the data and might give you some intelligent advice on how to keep well, how to keep healthy, and what to do. So it's all about data. We're living in the data, or we're approaching the data economy, and also our health and care systems, they will become data-driven. So what are we as a commission doing in that field? I suppose you all know the commission because you can get money for research and innovation from us, but that's not the only thing. We're also helping on setting up digital infrastructures in order to connect all the dots all over Europe. But maybe even more important is that we need to connect the stakeholders and bring people together in order to really accelerate innovation, so through collaboration. And when it comes to the digital transformation of health and care, in April we launched a communication stipulating what our actions are for the near future, but also for the next framework program, and how we will help you as a citizen, as a company, as a researcher in Europe in making this happen. There are three important axes here in this communication. It's the secure access and exchange of health data pooled for research and personalized medicine. And then the third one is about digital tools and data for citizen empowerment and citizen-centered healthcare. And that's exactly the topic. How can citizens monitor their health, adapt their lifestyles, and interact with their doctors and carers? And that's exactly what fits in the scope of the topic that we're handling here today in this session. And what are we doing, or which activities did we start in the past when it comes to mHealth and apps? Is the code of conduct on privacy for mHealth. It's an industry-led initiative that started back in 2015 or 16, if I'm not mistaken, and that is facilitated by the European Commission. So there were several iterations on the code, and the last submission to the Article 29 Working Party of the Data Protection Working Party was end of 2017. And we got their feedback in April, and now we'll have to see how we deal with this feedback, and also with the fact that this data protection working party is not in place anymore because GDPR started. So it's up to the industry team to see now what the next steps are and how we take this code of conduct further under the GDPR. There is also a project ongoing on an mHealth hub. So we'll set up an EU mHealth hub that will support member states in implementing national mHealth programs. For that hub, there is a selection process ongoing to select the host for the hub. And one of the objectives will be to come to a common mHealth assessment framework for the integration of mHealth into the health systems, and also active support to countries who want to deploy an mHealth strategy and integrate mHealth tools in their healthcare systems. There is also a study on safety of non-embedded software in the health sector, which is a broad study. It's not only tackling health, but also connected cars, robots, so non-embedded software in different applications. But there is a subpart that's dealing with the healthcare domain and health apps more in particular. And there we're gathering evidence on the safety risks of non-embedded software. And the report will be published soon and will be made available for everybody. But the first findings are that there is a lack of reported incidents, and that so it's very difficult to assess. The current Commission mandate is coming to its end, so we're already working on the future and on the next framework program. A budget proposal for 21-27 was proposed by the Commission just before summer in June. And when it comes to health and digital, we see that it has a prominent place in these future programs. Horizon Europe was also proposed just before summer. That's the successor of the well-known research and innovation program Horizon 2020. So there you see that there is a pillar 2 which has a cluster on health. And in this health cluster, there are 6 main areas of intervention proposed, where we see at the bottom that the digital tools in favor of health, so tools, technologies, and digital solutions for health and care, are also one of the main areas of intervention in this health cluster. The strategic program for this Horizon Europe program will start beginning of next year, so that the first calls are ready to start the first projects in 2021. Digital, so that's health. Digital is also all over in the next multi-annual framework program, in not only in the research part, but also in a new program that's called Digital Europe, and that's meant to support the infrastructure, the rollout of digital tools throughout Europe, and to strengthen the digital industry, but also to make the digital transformation happen. And it's focusing mainly on technologies. So you see that high performance computing and artificial intelligence are the biggest domains where this program, this deployment program, will invest in. But of course, these are also technologies that are very important for health and care, and so they will apply to healthcare, and there will be new opportunities, and that's a completely new program that was not there before in the previous framework. So I will leave it for that. I have put the links with references to everything that I just told you on this slide, and also my contact details are here, so don't hesitate to approach me if you have further questions. Thank you.
Thank you, Birgit. This was a very nice, fast overview. And I hope that our hosts here will make the presentations available not too late, so you can still benefit from this nice, very condensed information. Would there be any immediate question to Birgit on the Commission's program? So otherwise we will come back to question and answers after all presenters have spoken. So it's my pleasure now to invite to the stage Malte von Tottleben from Empirica. He will speak to us, Be Healthy, Be Mobile, Building a European Knowledge Hub for mHealth in Preventing and Managing Chronic Diseases. So Malte, thank you for coming, and up to you.
Thank you for having me, and it's a pleasure to be here today. So we've just heard from Birgit on the digital transformation of health and care to empower citizens in building a healthier society. And we want to use digital services such as mHealth to enable today's society being healthier. As said, my name is Malte von Tottleben. I'm working at Empirica, which is a Germany-based company. We do research and consultancy in European projects mostly. And also we do a lot of studies on everything in the context of health and energy and e-skills. Just press here. So just to refresh your minds quickly, the WHO definition of mHealth is medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. So it's not only about apps, but it's also everything that has to do with mobility and the use of health technology. So why should we make use of mHealth in the first place? Well, we see a dramatic increase in worldwide mobile phone use. We have figures from 1 billion subscription to mobile services in 2002, which rose up to 7 billion in 2015, and that's a penetration rate of 97% of the population. And that's quite a market there that we can use, and it's so mHealth, that makes mHealth as one of the most attractive areas of public health interventions that can easily reach broad majority of the population and covering many different backgrounds of people. So what's the magnitude of the issue actually? So we have non-communicable diseases, NCDs, which kill about 40 million people worldwide annually. And in the range of 30 to 69-year-old people, 50 million people die yearly from non-communicable diseases. To that count cardiovascular diseases and cancers, respiratory diseases, but also diabetes. We see that these four groups alone account for 80% of all premature deaths. premature being the people between 30 and 69. Now, mHealth could play a major role in achieving universal coverage of healthcare, and it's key in supporting new models of integrated people-centered healthcare services. And this is particularly true for increasing access to quality health services, and that is especially for hard-to-reach populations, by reducing premature mortality from non-communicable diseases, for instance through tobacco use, alcohol use, unhealthy diet, lack of exercise, having an impact on key risk factors by improving disease diagnosis and tracking. That also includes diabetes, cardiovascular disease, cancers, and respiratory diseases, and also by increasing the safety and quality of care and increasing patient and family or community engagement in the care. Now, some of you may know the initiative from Be Healthy, Be Mobile from the WHO together with the ITU, and they have initiated this in 2013, preliminary for the developing countries. So this is a set of comprehensive planning tools designed to improve the capacity of the countries to implement sustainable mHealth programs at scale. And here it is really important to think about the scale. So the tools provide in-depth information on how to develop and implement large-scale mobile health programs to prevent non-communicable diseases and their risk factors. Now, the Be Healthy mobile handbooks contain information about, for instance, the program management, the content development and adaptation, promotion and recruitment strategies that could be used or should be applied, technology selection for message delivery, and establishing systems for monitoring and evaluation. They have a generally global perspective, and they implemented in countries, or until now they implemented in countries such as Senegal, Egypt, India, but also UK or Costa Rica. However, we see that these tools are currently rather static and based on what technical solutions are available in such countries, which are rather at the low or medium income countries today. And if we want to apply anything like that in Europe, we need to adapt the tools to the European regions with their specific characteristics. Taking M-Diabetes as an example, M-Diabetes is one of the handbooks that Be Healthy, Be Mobile developed. We see that the focus of mHealth solutions in the initiative is currently on awareness-raising SMS messages. For instance, text messages were sent with warnings or diet recommendations during and after Ramadan, which was called M-Ramadan, in Senegal in 2013. And studies show that SMS sending was associated with an improved glycemic control in type 2 diabetes patients. However, the focus of mHealth solutions in the EU is different, and it should target new digital solutions using mHealth, such as smart applications, wearables, low-cost devices, artificial intelligence, but also machine learning and big data. And such digital solutions grant access to data with sophisticated indicators that allow for more detailed analysis, including also intervention effectiveness and socio-economic impact analysis to ensuring sustainability of the solution that is proposed or being implemented. All right, I skipped the slide here. So the scale-up models for any of such solutions will be different, and I expect it to be different from the traditional SMS models in a number of ways, including the evidence base is less advanced than for the SMS solutions. Secondly, in national scale, implementation costs will vary. So we have different devices, different maintenance costs, costs for updates and so on. And there's also a number of unresolved regulatory issues, such as interoperability and data protection. So altogether, while they may provide, or while mHealth solutions in the European Union may provide a broader range of opportunities for preventing and controlling NCDs, their use is much more complex. So our suggestion is to implement a central mHealth portal that could be needed, including tools, use cases, solutions relevant to the EU countries. And this would allow EU stakeholders and regions to receive tailored support for developing and deploying mHealth solutions. Tailored meaning providing a framework to tackle NCD under consideration of European national characteristics such as cultural differences, digital health policy priorities, and present political challenges. For such a central mHealth portal, and Birgit has already mentioned the mHealth Hub earlier, which is a call currently under investigation. For such a mHealth portal, we advise taking into consideration not only technical and organizational aspects, but also cross-cutting topics. These include monitoring and evaluation, impact assessment, cost efficiency, and also, last but not foremost, the sustainability of the solution. And this can improve the evidence base on the effectiveness of any such solutions that are implemented. So more guidance is needed on the assessment frameworks for ML solutions to help the EU member states and companies developing such solutions to select, adopt, manage, and deploy any solutions for good governance and for investment decisions. There's a number of tools already, and we at Empirica, we have evaluated the selection of tools in the scale AHA, which is the scale Active and Healthy Aging study, 3 of which are listed here in the table. The maturity model was developed within the European Innovation Partnership on Active and Healthy Aging, and it has a strong community already and addresses scaling up through matchmaking of regions. The MAST tool, the model of assessment of telemedicine, is based on health technology assessment, and it can be rather time-consuming, but it's also for rather mature solutions. And the MAFIB tool, the monitoring and assessment framework for the EIP on active and healthy aging, was created against the backdrop of active and healthy aging, which is generally, the data is generally scarce and scattered. Now there's also a 4th tool that I want to present shortly here, the Assist Toolkit, which is a cost-benefit analysis toolkit, an approach that can be complemented with discrete event simulations on the effectiveness of ML solutions, and it takes advantage of the effectiveness and the natural history of disease, and is a great tool for complex interventions. It is also a rather complicated tool. It's a professional tool, not a layperson tool. But it has been already applied many times in various projects, including CareWell or Beyond Silos, to assess the impact of any technology implemented. And this regards specifically complex organizations and systems with a multitude of stakeholders. So apps and monitoring are usually embedded in organizational processes to effectively support the patient to follow up and prevent further disease progress. And to reflect such complex organizational processes, we need simple assessment. The simple assessment and validation is not enough, but we need to assess the value for different stakeholders, which is essential for the scaling up. So here I present you just quickly the output of the Assist analysis that we've done in the CareWell project, for instance. On the left side, you see the cost that we evaluate with some of the indicators for primary care organizations. So we differentiate between different stakeholders in the service implementation field. Here we have the primary care organizations, and this can be, for instance, staff time spent on training, the general IT software, extra time for service provision, but also there's benefits to service implementation. That could be, you see that here on the right side, for instance, the resource liberation for general practitioners, and also external financial support. So this table would look different for each of the stakeholders that we regard in any service implementation. And a typical outcome presentation would then here look like this. For instance, on the left side, we see the outcome, for instance, in the project with European Commission funding, and on the right side without European Commission funding. And oops, now I closed it. Here we go. So we can, for instance, see that with EC funding, we have an overall socioeconomic return of 24%, while without EC funding, the overall socioeconomic return is only 9%. And this is specifically important for primary care organizations. When we regard the specific stakeholders here, we see the difference of 4% and negative 90%. So the implementation of the service that was implemented here in this case makes a tremendous difference if you have EC funding or not, and it may introduce you to any knowledge and insight into who are veto players. Now, in summary, mHealth has a huge potential also in the EU to prevent non-communicable diseases, and the Be Healthy, Be Mobile initiative paved the way by showing use cases. And new technologies introduce chances, but also challenges that we must tackle. The EU stakeholders could benefit from a central mHealth portal, but such a portal needs more evidence and evaluations with regard to large-scale impact and deployment and modeling of complex interventions. So there's a variety of tools already out there that can be used, and each of them has their specific use case, and we advocate to making use of increased use of such tools to any stage of your mHealth solution that you want to implement, and to to increase the knowledge on large-scale adoptions of ML solutions, which should be accessible on a common portal in the EU. Thank you very much.
Thank you, Malte, for this interesting overview over this kind of, let's say, high-level implementation guidance, which can become very practical. Any questions to Malte van Tottleben? Okay, then let's continue. Now we continue with, let's say, I think we moved quite a bit now to implementation and practice by giving the word to Dr. Michaela Seemann-Montero. She's the director of the National Health Center of Telehealth and of the SNS 24 service at the Shared Services of Ministry of Health in Lisbon, Portugal. Sorry, I made it wrong. The shared services are part of the Ministry of Health. And she will now present to us some real-life implementations of mHealth supported apps in the healthcare of Portugal.
So, good afternoon. Thank you very much, Stefan, for inviting me to share a little bit of the approach that we have worked on in Portugal. Actually, I would like to give you just some background that will make you understand easier what I'm telling you next. So, Portugal is at the western tip of Europe and has 10 million citizens. This is the size of the country. It has a national health service. It is tax funded, so it is very similar to the British one, to the British NHS, which is, I think, well known here. It has every citizen has a unique citizen health identification number. This is also important when you set up digital services. And 90% of public hospitals and primary care facilities run SPMS ICT solutions. So SPMS is actually the organization that I'm working for. It's the shared services of the Ministry of Health, and it's a public enterprise. Of course, Portugal has also a private ecosystem of private providers, but healthcare is still mainly provided by the public service for the population. Having said this, of course, being healthcare a public service, it is part, to a certain extent, to public administration, and therefore, when we think about setting up digital access forms to health, digital interaction ways for the citizen, we have to see this aligned with the overall strategy of public administration. So why is that? To become a little bit more concrete, and there is a public strategy for the digital transformation. For instance, if you as a citizen want to use the digital mean to access to public services or to comply with your citizens' obligation, then you have, of course, to authenticate you in a safe manner, so that the system knows that you are really the person you are claiming to be, and this is very important to create trust and to be able to provide the service in a safe manner. So therefore, we have two means to do that in Portugal. The first mean is by our citizen card. The citizen card has a chip. The citizen card comes with a PIN, and if I use it with my personal computer, I can authenticate myself when I access the public portals. Well, this is not a very practical mean when you want to go mobile. So recently there is another mean which we call the mobile digital key. So this is a tool where you identify yourself, and then you get a PIN. And together with this PIN, when you access, for instance, through mobile means, public platforms or other platforms where you need to authenticate in a safe manner, then what you do is you give your tax number, then you give the PIN, and then you get a token, and with this token then you can access, and the system assumes that you are you. So, and this works in the health system, and it works, for instance, in the tax system. By the way, recently it has become compulsory to declare your taxes online, so therefore you need this as well. Or for instance, if you want to renew your driving license, you identify you in front of the system through these means. But the strategy in public administration is not only about such a very practical thing, it's about the philosophy where, of course, often between organizations of public administration, there must be an information flow. For instance, when I want to renew my driving license from a certain age on, I need a medical declaration that I'm fit to do it. So the idea is I have to tell the system who I am, but only once, and then the system in the background will exchange the information between health and between, in this case, the responsible organization for cars and driving licenses and so on. Okay. Having said this, of course, this is what public administration is about, but the health system and the health ecosystem is a very complex one, as you all know. It has the public stakeholders, it has private stakeholders, it has the academia, and so on and so on. And many Portuguese citizens, they not only use the public system, but they use the private system as well. And to share information, you have to have common ground on information, information governance, on architecture, on interoperability, and all this. And one of the things I just highlighted it here. One of the topics of this strategy is the emphasis on mobile. So. Well, when you create mobile services, you have to, of course, have something to build on. You need services. I think this is pretty evident. So these are the backbones of the mobile services. And please let me share with you here some of the services that are already available in Portugal. Well, first of all, there is the electronic medical record, which is this. So this is something where every citizen has. There is a platform that gathers all the interaction that the citizen has with the health system, because there are also private interactions registered, and all the clinical information is locally stored. But if I am an attending physician, I can access these information via this portal, and I can see whether there were prescriptions, whether there was an inpatient episode, whether I went to the emergency department, and what my family physician writes has registered in the electronic medical record, and it's all. It all comes together on this platform, and I can have, as a physician, I'm actually a physician, I can have access if I'm attending the patient through this. So information is gathered there, and the patient has another view. I will tell you later about this other way. Then there is then there is digital medical prescription, which is also compulsory in Portugal for the private and the public sector. Then there is the digitalization of medical exams, and there are telehealth tools embedded in the software systems that are used in public hospitals and in primary care. So this is the view of the citizen. When I'm as a citizen go to the platform, I've got this view, and I can, after the strong authentication, I can look up some personal data. I have some resumed health summary. I myself, if I want, can add information. For instance, if I've got an intolerance to something, or I can put it there. If I can register the person to call if there is an emergency. I can upload my blood pressure and so on. But it has also my vital testament, for instance. But it has also a few services. I can ask for an appointment at my primary care physician. I can ask my primary care physician to renew prescription, and so on. So it has, at this very moment, 2 million users. We are 10 million, so it's not too bad. Well, now let's just present another service. You will understand why I'll present them, because they then have impact in mobile. This is the National Contact Center. The National Contact Center is a place where the National Health Service, SNS, delivers clinical and non-clinical services. Clinical service is a pre-hospital triage service for acute non-emergent disease. We get about 100,000 calls every month, so more than 1 million a year. So now when flu is coming, so we expect 5,000 calls a day, just to have an idea, where people talk to nurses. They have algorithms, and through the algorithms then they give advice or send to the primary care physician or to the hospital. And then there are there are also other services, administrative services. So somebody who is not able to go to the patient's portal because it's not a digital native, or it's not so digitalized, that person can call here and ask, for instance, to schedule a primary care physician's appointment and use the services that we also have digitally on the portal. So what we aim for is what we call an omni-channel between the patient, between the citizen and the national health system. So there are different ways to get the same service according to what the citizen is able to do. Okay? So, and now let's talk mobile. So in this omni-channel, we have the patient. Our aim is to have only one patient app, and not 10,000 apps that you have on your phone. We have the ambition to have in the future only one app, and this app, My SNS Wallet, it already exists. Actually, I put there some numbers to see how the interaction with the citizen has been doing. So And what's the idea of the app? It works a little bit like well, we took some ideas from the Apple wallet actually, some benchmark there, and what we do is so the citizen has the app, and then it can access to useful information, and he or she can download the information that he or she needs. So, for instance, the prescription. This is an example for the prescription, or results of medical tests, or some health information. For instance, your vaccines. There is the e-booklet of your vaccines, where you have your vaccines and then registered, and you are also alerted what are the vaccines to be looking for in the near future. The vital testament. Well, and some other features, like for instance also physical activity. Here you can see that really there is a fair good interaction, and it's increasing day by day. So, so the services you have on the platform and the information you have on the platform, they are becoming mobile as well. And this is how we are trying to, and this is the first time that I showed this in public. This is how we are going to transfer the SNS contact center services, the clinical services, and the administrative services into mobile. This will be the new site of SNS24. That's the name of the contact center, and we first designed it mobile. So this is actually not an app. It's the mobile version of the site, and it's a site where we want people first to try to solve their problems through this mobile service. And if they don't, if they get stuck, yes, then please ring us at the contact center. So, and we are also working, and hopefully next year it's going into production, a video appointment tool with a video that enables a video call with a healthcare professional. So, but there are also, of course, other people who do apps and who do useful things in the ecosystem, and this is still in a beta version. It's called My SNS Selection, and it's a process of curating health apps, and the endpoint is first to give it a quality seal. Okay, and some of these applications, some of these services may even be worth to be included in My SNS wallet as a card. So thank you very much for your attention. If you want to know more about what we do and how we do it, and what's going well and where we face problems, then visit us next year on eHealth Summit. This is a big event with last year we had several thousands of participants, 10,000 by streaming, and next year we have the pleasure to host also the annual meeting of the International Society of Telehealth and eHealth. So we will become more international, and you will find a lot of things in English. To join us. Thank you very much.
Thank you. Very impressive indeed. So will the event next year, will it run in English? I think the...
So many tracks will be in English. The telehealth tracks... Oh, sorry. Yep. Yeah, many tracks will be in English. So the telehealth track will be in English for sure.
Okay.
Yes. Mm-hmm. So.
Okay, good to know. one with your the second last slides where it says EU guidelines. Oh, so I have it still online. I can still look at it on my own screen here. EU guidelines on assessing the reliability of mobile health applications. Have they ever materialized?
Pardon? I didn't get the question.
I ask it to Birgit. Nasty as I am.
Okay, yeah, there was a working group on that, and there were a lot of experts trying to figure out which guidelines we need or what kind of quality checks we need, and but they didn't came to a conclusion. But there is a report on that, and we will take it further in the mHealth Hub project and build on that to come to this common assessment scheme.
Okay, thank you. No, that's definitely worthwhile. Good. So, any remarks? No? So, it's my pleasure to invite Professor Gernot Marx, President of the German Society for Telemedicine and Department Chair in the University Clinic of Aachen, to do his presentation on health apps as a perspective for better patient care and self-management.
Yeah, dear Dr. Schuk, thank you very much indeed. So let me start with maybe my summary already. I have a digital dream. So as the chairman of the German Society of Telemedicine, as well as a doctor, I think this is what is our task, so that we make the most out of our digital potential all together, and especially in Europe. Now, first of all, I want just to share with you some apps you might know, maybe not, just which is now recently become on the market internationally and nationally. So the Ada Health app is probably one of the best. So it was is well established in the moment. I wouldn't say that this company still is a startup. It's really now a company, but this is probably one of the health apps which is most advanced, and to give really personalized, interactive chat options, and give you really surprisingly precise health information, and also decision support. So this leads to a situation where relatives and patients come to you as a medical doctor and ask more and more good questions, and this is now bringing us to a well-informed citizen. There are other health apps like the Vivi one. This has been, at least in Germany, in the media over the last couple of weeks very often. Personally, I'm always surprised that still today these kind of apps collecting more or less PDF files only, bringing it so far in the public domain, because as medical profession, this is maybe it's some sort of useful, but I don't want to have just only apps. This is not what I understand. What is about interoperability, sharing expertise, sharing data, and you have shown this slide that European citizens, they are well appreciating sharing their data and bringing this to a better health understanding and solution of healthcare problems. But when you want to do so, we do need better apps than these ones. Obviously, one of the issues in the moment is, and I just bring you a couple of more examples, we have dozens of apps, hundreds of apps, some good ones and some bad ones. They are usually very specialized, like this diabetes coach, or there are others like My Sugar. So obviously the very frequent diseases like diabetes, heart insufficiency, high blood pressure, dementia, these kind of diseases trigger the industry to produce apps in order to being bored and helping patients. I just mentioned dementia. I personally think here we have a very good tool in hand, and this is obviously of interest for many of us, because I mean, who wants to be in this sort of state or disease when getting older? And the hope is that we can find out very early that we are at least under threat, and that this might help to avoid, let's say, a level of the dementia disease which is really not where we want to end. And therefore there's a lot of development here and a lot of interest from the research community as well as from the citizens. And it reflects maybe a potential from all these apps. One is that we can follow up patients, another is that we can do prevention, and thirdly, that we can collect a lot of data which we have not present yet. And these kind of data in association with the artificial intelligence really may open up new ways of research and healthcare in the future. Some key problems: data safety or data protection, and especially the controlled quality criteria. And this is what you just mentioned in your question. Obviously, this is now, let's say, I would say in the moment, a more or less free market or free development area. We do not have our cornerstones, which is what is really requested in order to be an mHealth app, which is has got some sort of a certificate, quality certificate, because what I need as a physician is that when apps measuring data, for an example, that who knows that these are validated data. When you measure your blood pressure, it might be perfect, it is probably perfect, but it might be wrong. And then you come to me and showing me hundreds of blood pressure measurements, and now I have to decide whether there is a high blood pressure or not, or we have to alter our medication. This is very difficult and something we really have to address probably on the European level in order to really be in the position to assessment and making some sort of validation steps. And this needs to be performed before we really bringing these kind of apps with a certificate to the market. And to be honest, I think there's an urgent need that we get something established EU-wide in order to avoid a pool of data which could be maybe used but is not usable because we cannot decide whether they are well measured data or not. Maybe in the end, I think time is more or less up. Yeah, well, our project from the Medical Informatics Initiative here in Germany, our project, the Smart Medical Information Technology for Healthcare, is comprising now out of 9 university hospitals in Germany, industrial partners like the Bayer AG or the SLP or Tiana Spirit Cisco. And we're looking into intensive care, into infectious diseases. We will build up a large database with many data which can be used then by our artificial intelligence and experts. And one thing is here that we can use apps also in the clinical scenario on the in the ICU, because you have 1,000 data per patient per hour, and even if you are an expert, you overlook a lot of things. What is, for an example, overlooked not only in Germany but internationally is the ARDS, acute respiratory lung disease, and this is associated with a mortality of 38%. And when we can diagnose it earlier, then we can induce the treatment obviously earlier also. And therefore apps are quite helpful because this is at hand, at the unit with every doctor regardless of the experience level, and then we will show, or this is the hypothesis, using these sort of apps to really deliver better care even in this hospital setting, not only outside the hospital. Obviously, we want to develop interoperability in Germany with a whole initiative from our federal state of for research, so BMBF. So between university hospitals, and regular hospitals with our GPs. And this is very important in order to get more out of our data and to make better processes for the care, as we just have learned from Portugal, who are obviously further developed in the moment than we are here in Germany. But moreover, this gives a lot of potential. We will have training simulation for our juniors. We have, as I said, treatment optimization. We can do better trials which will be then performed shorter. We can really comprise guideline compliance. I don't know whether you know the number of guidelines published alone for Germany, more than 700. Nobody is able to know all these 700 guidelines. So without support, we are lost here. And what I especially like is this virtual patient models. So our artificial intelligence experts, they can use data from large databases and then can create virtual patients. So we do not have to treat them in reality. We can construct them, and then we can answer questions that far more precise and easier. And all this will lead to a more precise medicine, and therefore we need those kinds of models as well as apps. And this is, I think, the ultimate goal for us, that we make the most of the digital potential in the next 10 years. And I was very happy to learn in your presentation that the Commission is spending also, but will spend even more money for this area. This will be definitely very helpful indeed. So thank you very much indeed, and we go over that here, and I'm looking forward to some questions. Thank you.
Yeah, thank you for touching on both elements, both the direct use of the mobile apps, but also this wider perspective that comes in now with the Medical Informatics Initiative and your projects. Okay, while the audience may still contemplate on what they would like to ask, I'm wondering, I think artificial intelligence, of course, we will cover it explicitly later on, but there seems already a strong linkage also to this mobile app domain. You started with ADA. I heard from Michaela Montero before that this next plan will also involve that the first line support may also be helped by artificial intelligence. So I think this is a very interesting view. Maybe we start with Birgit. Does the Commission already have a view to how this may come together, the artificial intelligence and mobile platforms? Is it part of any programs already?
Well, so in the next frame, we're already doing quite some things on artificial intelligence, and it will even grow in the next framework program, as I presented. And of course, there is also in the digital program a focus on digitization of public sectors and public administrations, and their healthcare is one of the focus domains. So, and it's clear that artificial intelligence has an added value for healthcare services and for advancing medicine. Yeah, we will focus on that, and we will work on that. But you have to gather the right stakeholders, because if you apply technology in one sector, or you use it for producing a car, or you use it in the surgery room, you need a complete different ecosystem, and we'll have to set up the correct ecosystems in order to apply the technology so it has a societal added value.
Okay, thank you. Malte, anything to?
Yeah, I think just what we see is that more and more projects that we are working in at Empirica have to deal with similar things at least, or things that go in the direction of artificial intelligence. I'm just currently busy in a project called C3 Cloud where we develop clinical guideline reconciliation. We've just talked about the 700 clinical guidelines we have alone in Germany on the many different diseases, and I think what we need is support for the clinicians to better reconcile the different recommendations given in such guidelines, and that could also use artificial intelligence.
Okay.
Well, sure. All the clinical and non-clinical softwares used, mobile and not mobile, they're full of potentially useful data. And as Professor Marx said, we need artificial intelligence to really get something out of them. Just let me share an example. We now are starting a project which is actually co-financed by our Foundation of Science, and it's done in partnership with Fraunhofer Institute in Porto. It's in the field of dermatology. So. And there is an app in the project as well. It's an app. It has to do with the differentiation of patients with skin lesions from primary care to specialist care, and what we want is them to do it through an app that ensures good quality of the photo, and then during the journey of the photo to the specialists, we are working on an artificial intelligence tool that helps to that will help the specialist as a decision support tool, attributing a risk to an image, a risk level to an image. So everything is inside there. There is an app, there is artificial intelligence, there are clinical and non-clinical data. And yeah.
Okay, thank you.
Maybe I just can share with you also some recent very good example, because to be honest, I mean, I'm a clinician, and artificial intelligence is always a little bit spooky for me, how it's really working. But one of my colleagues, who is an expert in artificial intelligence, he recently analyzed the MIMIC-3 database from the States, a large ICU database, and just using normal data we are collecting every day in every hospital around the world, he was able to show in this MIMIC-3 database that patients who are developing septic shock or developing non-septic shock and are discharged are really developing differently. So he's able to diagnose this deadly disease 12 hours before clinical symptoms are present. And I think here very clearly you can see that there's a lot in it which provides in the end better care. And therefore I'm personally very hopeful that in 5-10 years time we are really in a better on a better level than today due to these advances here.
Thank you very much. So I think we already take this as a final, more or less final words to close the session, to be on time this time. Thank you very much. If you still would have something urgent, say it now. Otherwise, let's thank us once more. The speakers really presenting very interesting lessons, insights to us today. And thank you for staying seated and being attentive. So in the Medica, it's always a little bit running around. So thank you very much. And we will continue in 10 minutes with the session on the other side of the page. This is on the new telemedicine landscape for patients in Germany, where we will reflect on what has changed in the regulations and how it is implemented in practice. So please stay or come back in 10 minutes. Thank you very much so far.